Okay, I will check with my colleagues about patient blood management.
How good it was that I followed the program on patient blood management. I must keep learning.
You must sign this. Please consider the risk.
No, doctor. I want patient blood management.
So what is perioperative PBM? When you undergo a major surgery, there is a high likelihood that you could lose almost 1 liter of blood. In some cancer surgeries, bleeding can go as high as 2 to 3 liters. Blood transfusion during surgery carries with it some risks as well. Perioperative PBM is used to describe how we prepare a patient for major surgery. We prepare the patient by ensuring that the patients themselves have a good level of red blood cells in their bodies. This is because when your red blood cell drops too low during the operation, there's a risk for complications in the heart that your body would be unable to function well due to low oxygen supplies. So, I would put perioperative PBM like preparing your car to go on a long journey, where your body is the car. We will first begin by preparing for the journey itself, pre-operative PBM, and then during the journey, intraoperative PBM, and once you reach your destination, post-operative PBM. Before you start your journey, what will you normally do? You would of course make sure your car is checked and well serviced. We would like to do a checkup on your body that is done in the pre-anesthetic clinic. One of the things that will be checked is your hemoglobin levels. The hemoglobin in your red blood cells are essential part of blood that carry oxygen. If you have low hemoglobin levels, you may need to be optimized. Ideally, prior to surgery, you should have a hemoglobin level above 13 grams per deciliter. So when preparing for surgery, the surgeon and the anesthetist, which is me, will attempt to optimize your hemoglobin levels. For elective surgery, it is of course better to produce the hemoglobin naturally. We encourage our patients to receive iron supplementation either through an injection or as a supplement. This provides the body with the raw materials to raise the hemoglobins naturally. This is a slower but safer process to raise your hemoglobin.
We also should always remember that just like starting a journey, before starting any surgery, we should consider when is the best time and what it will cost. Meaning, how much blood loss is expected and how much the body can stand it, and so prepare for it.
Dr. Pao, our patient is worried about bleeding during the surgery. Could you explain to our patient what can be done intraoperatively?
Yes, I will do it. We do careful surgery so that you don't bleed too much. And also, I will quickly stop any bleeding source when you identify the bleeding. We need to always keep your body at a normal temperature so that it will also decrease your bleeding during the surgical procedure. Sometimes we cannot secure the bleeding by suturing or other technique. We apply some specific glue to this bleeding source so that it will decrease the bleeding from you. Sometimes doing some complicated surgery that high risk of bleeding, we got a specific machine that will collect all the blood from you, will be given back to you. Finally, will decrease also your blood loss called cell salvage procedure. Finally, at the end of the surgery, sometimes we give some specific medicine called IV transamine. That will also decrease the bleeding at the end of surgery so that we will have less blood loss at the end of surgery.
How about after the surgery, Dr. Pao?
After the surgery, to prevent further blood loss, I will not do too much blood tests if unnecessary. I will give you medicine to decrease your risk of ulcer from your stomach bleeding. That will decrease your blood loss from you. Also, we'll monitor closely for any sign of bleeding at the end of surgery. If we noted that your hemoglobin level is low, I give you intravenous iron and blood production hormone called erythropoietin immediately. This will allow your body to make your own hemoglobin blood level over the next maybe 1 or 2 weeks. Even sometimes your hemoglobin level is a little bit low, I don't like to give you blood transfusion immediately. I think that is the unnecessary thing. So that just continue monitor you, even the hemoglobin level are a little bit low. At the end of the surgery, if your hemoglobin level just a little bit low, not too low, I just give you the oral iron and also folic acid. They will take you 1 or 2 months to improve your hemoglobin back to your normal level.
During the surgery, we actually work as a team with our anesthetist to maintain suitable blood pressure, to reduce blood loss and help the body withstand the stress of blood loss. Sometimes, they may dilute patients' blood using acute normovolumic hemodilution (ANH) so that less red blood cells are lost when there is bleeding. Despite any challenging situation, we can still overcome it with a great team that plans well, acts in a timely way, and employs multiple strategies to boost and preserve a patient's own blood. Considering a patient's own blood is precious like gold and the best, we need perioperative patient blood management to make sure the patient has the best chance going in and coming out of surgery successfully.